I'm going to be doing an intramuscular injection with the Z-Track method. So the first thing I'm going to do is make sure that I have an order for this. So I'm going to look here and I have an order, and then I'm going to make sure to check it with MR, make sure we have the right patient, the right medication, make sure they both match up, check the route. I'm going to check the dose, I'm going to check the time that we need to give it. Once I've checked all of those things, I'm going to go and check up my medication, wash my hands, and this medication actually is reconstituted, so we need to look on here and see how much of the diluent is needed. And I'm going to get my needles out here, and I have a bigger syringe here for doing this. Apply my needle here. I'm going to wash these with alcohol, draw up my air here, and I need a 5.6 milliliters, so I'm going to do this, 5.6, take off my cap. I'm going to insert this air in here, and then I'm going to draw up this medication, the solution here. And then once I have enough in here, I can tap it with my pen to get the bubbles out. Make sure we get enough. Looks like I have enough here, so I'm going to pull that out. Then I'm going to insert this into my medication here. And once I insert all of that in there, I'm going to recap my needle. And once I have that recapped, I'm going to discard of it. In my medication vial here, I'm going to roll it around in my hands. I'm going to gently make sure that this all gets mixed up in here. This might take a minute or so, so I'm going to make sure. And once I get it all the way dissolved there, I'm going to take a label, and I'm going to label this with my patient's name, the medication, the amount, the start date, and make sure that we have the right information in here. And once I do that, I'm going to get a fresh needle that I need for getting the dose out of this vial, and I'm going to give 0.5 milliliter of injection. So I'm going to attach a new needle on here. I'm going to draw up my 0.5 milliliter of air, uncap my needle. I'm going to insert the air in here, and then once I get that inserted, I'm going to draw out my 0.5 milliliter. And again, if I have bubbles, I can just kind of tap them there and get them all out. And once I get them out, I'm going to get my needle ready, recap it. I'm going to go down to my patient. I'm going to introduce myself. I'm going to ask them for their 2 identifiers. And then I'm going to find the site for the injection. So the first thing I'm going to do is have them stand up. I'm going to feel for the top of their hip bone here. I'm going to go 2 fingers below it, and then I'm going to kind of make an upside down V here, and this is the site that we're going to use for the injection right in between. Once we've identified our site, I'm going to wash my hands. I'm going to put on my gloves. I'm going to double check my medication before I give it and make sure that it's the right amount for this method. And we have this ready, so I'm going to use my alcohol, clean the site. I'm going to use my non-dominant hand, and I'm going to kind of just push the skin back towards the side here, uncap my needle, and I'm going to go at a 90-degree angle here, and I'm going to slowly insert my medication. Once I'm done, I'm going to pull that out, release the skin, recap my needle, and then I'm going to discard of it into my sharps container. I'm going to take off my gloves, wash my hands, talk to my patient, see how they're doing, see if they need anything. Once I'm done with my patient, I'm going to step out and I'm going to chart what was given, the medication, the amount, the site of the injection and the time that it was given.